It's my pleasure to introduce you to Martin from Palo Alto Medical Foundation. He is an example of a successful entrepreneur, a physician himself, as well as a software entrepreneur. And he built a clinical decision support company that was acquired by Palo Alto Medical Foundation in 2008. And now he is the executive director for the Health Systems Innovation Center at Palo Alto Medical Foundation. And in that role, it's his responsibility to promote innovation in health IT. So if you're interested in starting companies or have a company that needs to work with Palo Alto Medical Foundation, he would be the person that could guide you.
Okay, a little bit of background. I work for Palo Alto Medical Foundation, as Praveen mentioned, and I think you probably all know that's part of Sutter Healthcare. We're part of the traditional side of health and medicine. I want to talk to you today about how I think that world is changing. And I want to pull out on some of the themes that you've heard about from the various speakers. I think there's some really important messages. And frankly, I'm somewhat in awe to be up here following everyone else that's spoken along. But let's see how we get on. So I'm the executive director of an innovation center, and I truly am responsible for disruptive innovation. It's a great privilege to be in that position. We, in our work, are tackling two big initiatives. One is about personalized healthcare, and the other is about systems to support older people age successfully in place. I just want to pull out a couple of ideas that you've heard touched on, but our experience is that what underlies both of those big initiatives are, firstly, getting people to engage and take responsibility for their health, providing support for them to work and live in the community. Remember that people spend most of the time out there living at home, not in our offices and facilities. And at the end of the day, it's all about behavior change and the social determinants of health, as you heard from John. Let's think about practice of healthcare. I think still many people like to think of it in this way. You know, it's a friendly encounter between the physician and a patient. It's a warm, fuzzy relationship experience. But in reality, we're already at the stage of we're beyond that, sadly. And so the question was asked about, are the doctors going to get in the way of this? I know many would like the world to go backwards. It's just not going to do that. We have to live and understand this world that's changed already. And in my position in a large healthcare system, that's one of our big challenges. We are being disruptive, and we have to work out how we're going to play. We're no longer in control of the delivery of healthcare to people. So I was asked to talk about 2025, and to be honest with you, I don't think my crystal ball is any better than yours, but I'm going to have a shot at some ideas that I think are pretty important. I'm going to talk about new models of care, new consumerism, locations of delivery, touch on technologies, financing and legislation. Consumerism, interestingly, is something that I don't think a lot of people have been talking with you about this morning, but I think it's really, really important. We tend to think that we can drive healthcare, big systems, plans, technology, and people will buy it. I think the world's changed already. We're already being driven by the way that people want to consume healthcare, which is very different from the way it's been before. I bet all of you are fed up of having to go and see the doctor. We heard already about the time it takes to make an appointment, the disruption of doing that, how long I have to wait. People are no longer willing to do that. So that's an example of changed consumerism. There are many different players in that, particularly individuals, but we shouldn't underestimate employers, businesses, etc. All are part of seeking a change in the way healthcare is delivered and consumed. But I particularly like to focus on the aging population. I could throw slides up here of the growth in the age of the population. We all know that. Let's think about the social impact. Older people without support, and that's particularly true of the more traditional American society. We should stop and think about, is that the case in other societies? And many of you reflect ethnicities and races where that is not the case. We have a lot to learn about what is still done in other countries to support this really important process. It touches again on the theme of community support and making sure people can survive in their own home, in place, successfully. New models of care. I think the big themes here are about getting people to engage and be responsible for their health outcomes. We can no longer get to where we need to by just doing things to people. As Dr. Paul Tang, who I report to, responsible for meaningful use, calls it, we're too used to just shouting at patients, shouting in parentheses, and expect people to just pick that up, learn, and go and make changes. It doesn't happen. We have to think differently. And we have to build systems of care that have people at the center, have people engaged, provide the tools and information so that they can drive better outcomes. They need to be the owners and drivers of that process, and we still have a lot to learn about how to do it. Now, don't get me wrong, all the clever tools, the Fitbits, all the other devices that you hear about are really important parts of that process, but they're enablers of a process that has the individual, their responsibility and buy-in at the center of it. New locations. Well, there's no collusion between John and myself, but I completely agree about this. We are in the business of shifting care to the community. That is very, very disruptive to a business like ours. Currently, the system that I work in is paid to have people come to our offices, paid to have people treated in hospital, and yet we believe we have got to make a significant shift to care in the community. And I'm not just talking about having offices carefully located out there. It truly means supporting people in their own home. If we were to provide doctor visits back to people in the home, et cetera, it's not financially sustainable. How do we overcome those kind of challenges? So part of the solution to that is what we already see going on, what I'd call care in retail environments. So you've already heard from Safeway. I'm not picking up on any particular companies, but I use them by illustration. So the idea that you can go, when you're doing your grocery shopping, get your pharmaceuticals, and have an encounter, a consult with a pharmacist and get advice, that again is disruptive. Does that probably fit people's desire to be treated in the community, easy access? Yes, it does. If we think about some of the other dimensions that are going on, we ourselves, along with many other people, are providing care in vans to go out to people at work. It's another, what are we doing? We're responding to the demand to be seen, easy access at my place of work, not expect me to come to you. Walgreens, another example. And if you look at the kind of range of services they're providing, they're clever niche marketing. You can take your child in to get their health check before they go off to camp. You can easily get that. Probably if you had to get an appointment with your physician, it's going to take you far longer than taking them just down to your local store. Now, this is just snipping away at the edges, but does this reflect a very fundamental shift in consumer requirements for care and the way that care is going to be delivered? Yes, I believe so. And of course, we have examples of many companies, some of you may work for those, that are providing facilities, clinics at the workplace. And some of these are pretty sophisticated in the range of services that they can provide. So you've heard a lot about the technologies. Many of the people that have been on the panels and my preceding co-presenters have been covering these, but I just want to touch on a few. So we see new ways of doing surgery, a typical reason for going into a hospital. Can that surgery be delivered remotely, robotically? Yes, it could. Is it conceivable that those robotic surgeries might be done in Safeway? Wow, now I'm being pretty crazy, aren't I? But is there any reason why not? 10 years from now, if we've managed to cover the safety, etc., for certain surgeries, maybe that's in you drop in for the morning, get it done and leave. I don't know. But would that be disruptive? Would that be changing? Certainly would. And we need to think about those kind of possibilities. I put the tricorder up there because it represents a view on diagnostics, testing, etc. But it's beyond that. I think there's a huge opportunity in testing in a place close to you, but also this ongoing quantification, evaluation. And you've seen examples of that from a number of presenters. Continuous monitoring input of you, about you, your issues, etc., in your day-to-day life. Hugely important. Now, in some of the projects that we're running, we are using that kind of data already. It's not that complicated. It's things like blood pressure or glucose or ongoing exercise as part of, say, your diabetes management. But I can tell you how impactful that is to be able to feed it back to physicians in a way that they've never had access to the data. So think when we get more sophisticated by ECG data, etc., what more we could do with that. And at the price point, it's already available. I'd like to think, too, about how we enable access to care. We all talk about M-Health, but I already think that it's beyond that. Think of the possibilities of avatar call centers that have got the ability to relate to you, maybe in your language and your personality. That kind of process is going on already. Huge opportunities there for better conveying information, supporting people's needs without the need for a face-to-face visit that historically have been, we all know what call centers are like, how much we love them, etc. But if we can shift that dynamic, think of the possibilities. I'll go back to the seniors. One of the biggest problems in the senior space is loneliness and isolation. Imagine if you could have a meaningful interaction with an avatar, and again, I'm not dreaming. Think what difference that could make if isolation is your problem, and otherwise you have no access to people close to you. Financing. I think financing is a huge issue. Again, we all know about the growth in costs, the unsustainability of it. But you heard in one of the earlier presentations of something that's going on that's really fundamental, that's likely to lead to huge problems. It's cost shifting. Where is that cost getting shifted to? You, and me. And it's a very significant percentage of cost that we're going to have to pick up. It's not going to be sustainable by us. What is going to happen? We have to find ways to deliver care at a lower price point, and we have to find ways of delivering care that don't involve the costs they currently do. I believe that's going to involve a requirement for far greater support between people in communities than has gone on recently. It's the way it used to be, but if we don't get back to that kind of approach, we're not going to be able to afford the paid-for services that are otherwise required. And for those of you who've had to look after elderly parents and think about the cost that has landed on you, you know what I'm talking about already. Think too about, I'm back to consumerism, the consumers are already voting with their feet, or their pocketbook more accurately, and the amount of money that they're already spending out of their own pockets in non-traditional healthcare, it's significant already. It's in the billions of dollars, probably just close to 300 billion right now. Think of that 10 years out. If what I'm saying is true, that people are not going to be able to afford traditional healthcare, have very high co-pays, and yet they're going to have to provide services for themselves somehow. They'll be finding other clever ways to satisfy that need. So legislation, sad to say, whilst I'm not a great fan of it, I think there is going to be a significant amount of increased legislation. You think about the things that are already on us and coming down the pike, the impact of genomics, the impact of other possibilities of selective choice of care based on your genome. Think of the potential for abuse of that, even though it's got huge potential for benefit. And I think you're going to see significant regulation coming into play. Sadly, it's probably going to be a barrier to protect people before we work it out as to how we can use it for benefit and good. But I think that's going to be a major feature of what we see in the future. And so back to my theme, the new health economy in 2025. For physicians, is this what it's going to be like? Is it just a mechanistic process using high technology to make diagnoses, determine what you need for care, out you go. At the end of the day, it's that little robotic doctor down to the right. Well, no, I actually am a great believer in it's really all about the community. It's going to be about health and wellness for people that matter, delivered in the context of the community. And I think it's we, the people, that are going to drive that, because we have a fundamental need to be safe, protected, healthy, in order to lead our meaningful lives. And so all of this that's going on around us is a big opportunity being driven by technology, social change, etc. But at the end of the day, I would keep your sight on the people, the consumers, and what people are demanding. That's where the opportunity will lie. I'd also suggest that many of you being entrepreneurs and looking for the opportunity, I already think that we're beyond just the hot opportunity in a narrow area of technology. The reason healthcare is so hard is because it's part of a large and complex system, and to truly deliver value out of these components of technology, service, etc., it has to be part of that system. The challenge is the system is not going to be the one that we know. We're moving to something very different, and no one is going to easily be able to tell you what it is. It'll have multiple players playing multiple parts. But I would look to find your way to place yourself in a system, and how can you add value to that, even though you may be able to have a very successful business short term dealing with a narrow aspect of that. But the value is going to be in the systemic approach to the delivery of health and wellness. Thank you.